Well, hello and welcome to everyone joining us here today. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Well, I'm very excited once again today, sitting down with friend and colleague, Melissa Cole. Welcome, Melissa.
Thank you so much. It's always a joy to be here.
We were just reminiscing off camera
Yes.
about how many times that we've done this and the times that we have worked together. We have been so fortunate, I think, and very blessed to be in each other's workspaces and
Yes.
be able to connect with each other. But yet, there is
Yes.
still so much space apart. We haven't been able to be together in person recently. And so
Yes.
I have to say, I still miss you, and I hope that
Miss
we
you
have an
too.
opportunity to be together soon.
Yes. Very soon. I'm hopeful.
That's right.
Yes.
And like many of our folks listening in, I'm sure you have those desires too to connect with your colleagues and, be in those face-to-face spaces. But we will do our absolute best to bring you all together here because that's what we're doing here at Gold Lactation. And in fact, right around the corner, we have our Gold Lactation online conference coming up. It begins on March 29th. So that's really soon. I want and hope that you can join us actually on that day because we have Nikisha Killings. She is our opening keynote, and I know that you're all looking forward to joining it. That will be a free and open access, of course, to all of you listening here today, which is wonderful. But let's get to the subject matter at hand today with Melissa Cole. Melissa, we want to share a little bit about where you are once again, and
Yes.
perhaps tell me what have you been doing this time since we last spoke?
Quarantining, no, like everyone else. I'm in Portland, Oregon, and we've had a rainy, a little bit snowy winter, and now the sun is peeking out, which is wonderful. I feel a little bit human again.
Whew.
Ah, but staying safe, doing due diligence to keep everyone safe and well. But yet, I think the COVID baby boom that was predicted is real. Seeing a lot of babies being born and needing support.
Mm-hmm.
So,
That's
so that is fun.
wonderful.
Yes.
That that's keeping you busy. Have you been working on anything recently? Anything in the works?
Yes, I've had a lot of different things happen recently. I've been working extensively on a clinical herbal database for
Ooh.
clinicians to be able to look up and see is this safe during lactation or
Mm-hmm.
not. So that's been really gratifying to see that kind of blossom into an actual database.
Excellent.
Working on a few articles and just staying busy.
That's awesome. Well, I'm glad that you're staying busy, and I've got lots to do with these babies coming
Yes.
from our little boom there, which is fabulous.
Mhm.
Let's talk about what's going to be coming up here at the conference because this topic, oh boy, I have to say it's a big one, and I know that you're struggling to get everything into the presentation. But let's just say first of
Yeah.
all what the topic title is. So, common infant digestive health concerns and
Mhm.
useful support strategies. So, common infant digestive health concerns. My goodness,
Yes.
that's a big one. I have to say. I mean, there is a lot involved in this.
Absolutely. And there was a interesting paper that came out in 2019 that found that about half of all the newborns in their study had some sort of functional gastrointestinal disorder
Wow.
from 0 to 6 months. And I would say that is actually reflective of what I see in practice.
Mm,
About half the babies I see seem to have some sort of digestive disorder, whether it be infrequent bowel movements or
mm,
reflux or excessive gas, whatever they're
right.
coping with, it often masquerades as sort of a latch issue in disguise,
Mm.
and, contributes to feeding concerns. So,
Yeah. So these weren't perceived things because I think that's something else that comes up is that there's a lot of perception in this area as well, where some of this behavior is normal. And so it's a learning curve in,
yeah.
perhaps parenting and then maybe sometimes wrongly identified. This was actually real cases.
Yeah, absolutely. And I think that's true. As lactation professionals, maybe we think, well, that's not my job. That's somebody else's job to talk about digestion. But honestly, we're often the first line of defense if there's
Hmm.
fussy feeding, suboptimal weight gain. And sometimes we'll see when we're really doing a good assessment that the infant's struggling to feed well or grow well because of some sort of tummy issue they're dealing with. And
Right.
so we really are an important part of that allied healthcare team when we're seeing babies dealing with feeding issues. We have to be good detectives and also assess their digestive health.
Yeah, I don't think I've ever actually been in the company of a family with a newborn who hasn't either brought it up or talked about it even, briefly. Because if they haven't thought about it, there's another person in their midst who's talked about digestion
Yep.
or, is this normal behavior?
Correct.
Can you tell me everything from crying to gas
Yeah.
to the distension, like so many things.
Yes.
So, I mean, this is a conversation we really should be well versed in, bottom line.
Absolutely. And what's normal, what's abnormal, and what's a red flag that we really need to get them some additional care.
Yeah, absolutely. That's wonderful. Well, the other thing I wanted to mention too, to those of you who are listening in, Melissa's going to be part of our add-on package, one of our add-on packages, I should say, as part of our Gold Lactation Conference. You can go to the website right now, goldlactation.com, to check out all the details of the conference, especially for our live events. One of the things I want to let you know is that Melissa will be part of a recorded package, so she's recording ahead of time. And one of the advantages of that is that it will be available to you right away come March 29th. Woohoo! So you'll be able to jump right in to one of these dedicated packages. Now, the name of the package that Melissa is going to be part of is Translating Knowledge into Practice, Creating Effective Lactation Care Plans. So know that that's going to be part of her package, and you will be able to find it on the delegates dashboard. It's available to all of those who register for the conference. All right, let's dive into some of the things that you're going to be talking about. We just got a couple of minutes left, Melissa. So could you give
Absolutely.
me a little inside scoop into what we're going to be learning?
Yeah, absolutely. We're going to take a little journey through the development of the GI tract, and then we're going to talk about some of the common digestive concerns we might see, including bowel movement patterns, reflux,
Hmm.
and then what are some basic care strategies we can support families with to ideally help improve comfort and feeding outcomes for these infants.
Right. Okay, that's good. Because I was just thinking to myself, just as you were mentioning a few things there, every time I think I know exactly all the symptoms, or perhaps some of the things that transpire, some of the things that can happen alongside each one of these individual things like reflux and such, is that I'm always learning new. So there seems
Yeah.
to be new discoveries all the time.
Yes.
Am I right in that?
Yes.
Like, are we doing more research? What's happening?
Absolutely. Absolutely. I think that even in the last 5 years, the proliferation of research is pretty impressive. And yet there's still a lot to be done,
Ah,
especially when it comes to pediatric gastrointestinal issues. We have a lot to learn, but I think there's some good stuff coming out, and I'm excited to share that with our delegates.
yeah, that's awesome. There is one more thing that I have to bring up that I just was having a little look at in your slides, and that was about pooping. Can we
Oh,
talk about that
yes.
for a second?
There's
Because
going to be
listen, that's a big topic,
big
okay?
topic and so many myths, right? What's fact? What's fiction? What does the science show? What are we seeing in practice, right? Everything from explosive frequent poops to my baby hasn't pooped in 2 weeks. Is it normal? And so we're going to debunk some myths and really talk about how to be good poop detectives.
I like this has always been one of my job
Yep.
features. I have to be a good poop detector. So I
Yes.
definitely looking forward to that. Okay, so you heard it here first
Yes.
from Melissa Cole. We're going to be learning a lot about the digestive system
Yep.
and how it really does impact infants. But we'll also be learning how to be really good poop detectors as well. I feel like as funny as it is, it's quite serious
It
sometimes
is.
because
Absolutely.
I don't always know how to answer those questions
Yeah.
clearly. So I will look forward to definitely having some more knowledge in that area. Well, thank you so much, Melissa.
Thank you. Thank you for
So good to
having
have you
me.
here.
A pleasure. Thank you, Fiona.
Thank you. And to everybody listening, thanks for joining once again. If you've got questions for Melissa right now, you can pop them into the link below. We would love to get those to her. And then, of course, you can join us online at goldlactation.com for the full conference. We've got forums dedicated for our delegates there as well. So you can pop in there and ask questions about this conference and all the others that we'll have online. Thank you again to Melissa Cole for joining us here today, and to all of our viewers. Have a wonderful rest of your day. Bye-bye for now.